So, sound check. Can everyone hear me in the back? Great. So, thank you, Scott, for the introduction. It's really wonderful to be here. Thank you all for coming to this session. And I know it's right after you've eaten. Hope I won't put you to sleep. I'll try my best. I think some of the material is going to be quite new for many of you, so this will help keep you awake. The title of my presentation is Neurodietetics, Lifestyle Intervention for the Mental Health Crisis. I will give you a spoiler alert. The lifestyle intervention of which I will be speaking is whole food, plant-based intervention. Yeah, absolutely. And I think this could be a key for the mental health crisis, and I will be explaining what that crisis looks like. A lot of the information that is in this presentation is in our website, moodforlife.com. And this is a copy of the current logo for Mood for Life, but you can find much of this material on the website or in a forthcoming book called Mood for Life that should be out in about 6 months or so. Also, a source of information, as Scott mentioned, is Neurodietetics, Food for Flourishing. And this is available right now. Now, the Neurodietetics, we were really trying to come up with a good title for this book, and we considered a lot of possibilities, some maybe a little more familiar that might be better. For example, we considered how not to want to die. Right? You can live, but do you want to live? But we thought, that maybe was inappropriate. So we looked at a different one, greens over blues. Greens over blues, kind of been done, so we rejected that as well, and we stuck with Neurodietetics. Now, one of the main purposes that I have here for you all is to bring to your attention the neuropsychiatric issue in addition to other health issues. All of us here are very interested in health, generally. Many of you are more interested in the cardiovascular than other vascular and other kinds of diseases. So what I'm going to do in the next few slides is try to convince you that the neuropsychiatric deserves a seat at the table as well. So this slide is titled Years of Life Lost. And the information on the slide, I have to bring this to your attention. If you don't know about this website and the study at the University of Washington's Institute for Health Metrics and Evaluation, you need to know about it. It's interactive data. It's up to the year. It's recent. It's the world's first and largest catalog of health-related data. Every year it comes out with the global burden of disease. And let's see if this works that way. Yep. Okay, so what we have plotted here is YLL, which is years of life lost, which means if you die of a disease and your actuary table says you should have died later, that's years of life lost. And if you look at that over the entire, this is for the United States population, this appeared in JAMA in 2000, this April issue of JAMA this year. You have this plot here. So years of life lost. Heart disease, by the way, just to calibrate this, that the height of that rectangle is 1,650 people per 100,000 people. So that gives you an idea of the scale here. First is heart disease, true. Then lung disease, and then road injury. That may not be something that would come to mind as third on this list, but then suicide, cerebral vascular disease, drugs, and dementia. So the last four of these rectangles are really in the neuropsychiatric realm. So if you bunch them all together, what you get is neuropsychiatric is number one in the years of life lost. And then heart disease, lung cancer, and road injury. So that's something to think about, years of life lost. Now, the next slide is kind of hard to talk about, as you'll see if I can make this work. And let's see, I'm trying to figure out how to do this here. Here we go. It's a difficult topic, child suicide, but let's talk about it because it's very important and it's becoming even more important. So on this we have, and by the way, this is my main professional interest. I'm medical director of a child and adolescent psychiatric hospital system. So this is what I do every day, is attempt to reduce the risk of suicide in my kids. There's two plots here. On the left is the male and the right is female. So let's look at the left side of the male. We have on the ordinate the percent of deaths in the age group 10 to 14 that are by suicide. And then the years are on the abscissa, it's about a 30-year interval. So immediately you can tell, both female and male, that the suicide rate is going up. But it's going up really fast. So in the past 7 years, the rate of suicide for children, 10 to 14, has, in case of males, doubled in 7 years. It's tripled for females. So it's becoming more and more of an issue. We've got to do something about it. Then I'd like to also bring to your attention, if I can get this, there we go. Another way to look at the importance of neuropsychiatric, and this is another different kind of concept. It's one thing to have, to want to have years in your life, we've looked at that, but it's also important to have life in your years. And this is related to that. It's the years of life lost to disability, abbreviated YLD. This is a little complicated in how this is computed, but essentially disability is defined as having a loss of function that, because of an illness, to the extent that you can't work and socialize and that sort of thing. There are weights to this as well we won't go into, but in any case, this is for the world. This slide refers not just to the United States, but to the world. So the years of life lost to disability, as you can see, number one is mental disorders. Number two, musculoskeletal, and then neuro, heart disease, and cancers, and then cerebrovascular. So the rectangles that are outlined with red is neuropsychiatric, and if you put those together, you get just more of an emphasis on the neuropsychiatric. So neuropsychiatric illnesses are number one in years of life lost, and number one in years of life lost to disability. So that's a motivation for this talk. Now, I'd like to get more personal about this, though. And here's a slide about an American poet and writer named Sylvia Plath. Maybe you've heard of her through The Bell Jar, for example. That's her only novel, and it was written about a person who's depressed. She was depressed all her life. And I like the quote up on the top of the slide, and she was describing what is it like to be depressed. And she mentioned, it's like an owl's talons clutching my heart. Now, what I just did is, anybody know what this sign is? Yes. It's a Levine sign. If you ask a patient to describe their their pain in their chest, if they go like this, that's a Levine sign that indicates that, you know, maybe you should be thinking about some pretty serious etiology there. But this is an owl's talon clutching her very essence, her soul. And that hurts in a different way. So she made the quote, "Is there no way out the mind?" Another quote that comes from Sylvia Plath, this is in the bell jar. Well, she was given a Pulitzer Prize posthumously because she committed suicide at the age of 30 by placing her head inside her oven and dying of carbon monoxide poisoning. So that's a real person, and their description, a very poetic way of discussing that issue. Now, severe mental illness has been going up, and this plot here is the ordinate is prevalence of severe mental illness, like hospitalization severe, per 1,000 versus year, and this covers about 100 years. So how are you, why? I mean, why would the mental illness be getting more and more severe? Well, we have some thoughts on that in this book that my daughter Dagny AIken and myself wrote, and essentially it correlates, not causation, but it does correlate the change in our diets and processed food and what have you over the years with the increase in mental illness, particularly of a severe sort.